Coming up in just a bit, we'll talk about keeping your immune system boosted during the COVID times. But right now, we want to talk about our kids and what has been the impact on our children during this time that they've missed in school. To talk about this, we've brought in somebody who knows all about it, Dr. Janelle Ali. Janelle started with a BS degree in psychology. A Fulbright scholarship brought her to the University of Memphis, where she focused on neuropsychology and pediatric psychology. She did her pre-doctorate studies at Johns Hopkins University School of Medicine and is currently completing a postdoctorate fellowship in pediatric neuropsychology at St. Jude Children's Research Hospital in Memphis, Tennessee. Janelle, welcome to the show. Besides those great credentials and your expertise in this area, you're also a mother of two boys, right?
Yes, I am, and thank you for having me, Ken.
Oh, it's a pleasure to have you here, and of course we'll talk about kids because they're near and dear to both of our hearts. First, I guess I want to talk about the impact of really all of being out of school. A lot of these kids have been out of school since March. We're here now in July. Maybe you could talk a little bit about this impact on them.
So, Ken, it may seem obvious that missing school is not a good thing. And the importance of in-person learning has been well documented. And there's already evidence that there has been a negative impact of children missing school since the spring of this year. And we can think about this missed school in the context of what is known as chronic absenteeism. And that really means missing school for 10% of the year or for about a month. And we've seen that chronic absenteeism substantially lowers educational outcomes. So we can envision that academic achievement as well as psychosocial functioning can be impacted by all of this missed school. So lengthy time away from school can be associated with an interruption of the supportive services that often are received at school, and it makes it difficult for schools to identify and address really important learning deficits, even as well as child and adolescent physical and sexual abuse, substance abuse, depression, suicidal ideation. So missing school for this lengthy period of time can put children, even in the best of cases, at risk for both academic and psychosocial outcomes.
So we're getting hit on both sides of this whole equation, is what you're saying.
Yes.
As I hear you talk about these things, is there any age group that is affected more than another, or is it pretty much across the board effects that you talked about, not only academically but socially?
So missed school increases achievement gaps at all levels. So at the early schooling level, so that's preschool, kindergarten, first grade, prior research has actually found that chronic absence in kindergarten is associated with lower academic performance in the first grade, and that can impact literacy skills and mathematics skills. But we also see a really significant impact among high school students, where kids who miss a lot of school during high school, that's been a strong predictor of dropping out of school, more suspensions, decreased test scores, being overage for that grade, even when we control for things like their demographic and so like their age and sex, as well as their background. And some studies have even suggested that there might be a linear relationship where each missed day of school is associated with further decline in test scores, at least through the first 20 days missed. So there's a significant impact across all age levels, but the kids in high school might be at an increased risk.
Our guest is Dr. Janelle Ali. We're talking about kids and COVID and socialization, missing school. And, you just talked about the effects that these kids are going to have. Is there a way of catching up, I guess, is my question.
There would be a chance for remediation of skills, but the timelines would have to change for schools. So we can't be on the same timeline for graduation as we were if we plan on getting remediated for all of this missed school. And the transition back to school can be challenging for some children, and prior research has also suggested that it's harder for kids to transition back to school after all of this missed school. So yes, there's a chance for remediation, but what that's going to look like is going to have to be flexible and sort of dependent on the child and the school district.
And when we're talking about kids, the stress and the change is not only on them, but also on the parents, because the households change. You have a couple of children of your own, a 3-year-old and a newborn. Talk a little bit about what it's like or how your household has changed during all this.
So we've noticed So being home with a 3-year-old who no longer has access to his parents' day out, who we planned to send him to swimming lessons and soccer and meetups with his cousin. All of these things the rug has been pulled out from him, under him essentially, and now he no longer has access to all of these things because he's at home with us all of the time. And we've noticed that his energy level at home has increased, and also he's sometimes easily frustrated, and we've sort of chalked it up to cabin fever, but all of this is sort of representative of the impact of even someone as young as 3 years old. And what we've had to do as parents is sort of recognize that he's experiencing this with us and sort of provide him additional opportunities, safe opportunities for him to play outside, to have visits with his grandparents who are essentially quarantining with us. Sometimes what we'd call special time with each of us, just so that when he starts, we can see the signs of him feeling overwhelmed and could try to sort of be flexible with him and sort of work through that with him.
Well, I guess that leads us to tips, because as we do this interview in July, we have no idea what the future is going to be, whether a lot of this will be lifted in the next couple of months. We're still at a time where there's questions about whether schools are going to reopen in late August and September. Maybe you can give some moms and dads tips on maybe how to handle this in case this happens to be a much longer slog than all of us have thought.
It's a really good question, and I think we all have to recognize that this is an unprecedented time in our history, and that we have to be flexible with ourselves and our children. And one group that comes to mind right now is teenagers, and I think it's really important for parents to recognize that it's not normal for teenagers to be hanging out with their parents and their siblings 24/7, and to recognize those feelings. And it's also really important to show compassion to them, and that their frustration is real. And as parents, I think it's also really key for us to model those adaptive coping skills, because they're seeing our reactions, and it's going to be important for us to model the behavior that we want to see in them. And we can also encourage them to meet up with their friends outside safely, with distance, and maybe even be lenient with the screen time. I think also that it's going to be important for parents to talk to their children about COVID-19, because this transparent communication with them will help them to feel safe and grounded. And we can do that by acknowledging and validating their feelings and not dismissing their emotions. So I wouldn't say something like, that's not a big deal,
right,
but say something along the lines of, that sounds really tough. What do you think will help you feel better about this? And providing them facts. So there's a lot of misinformation out there on the internet, and you can help by asking questions like, where did you get that from? And exploring this topic from all sides, and also teaching them how to find research from a credible source. And as parents, it's going to be really important to take time for yourself. Parents are juggling a lot right now, and it's going to be important to take care of yourself so that you can take care of your family. And we talked about modeling those coping strategies, but also taking time for self-care and teaching healthy behavior that can help you teach healthy behaviors to your children. So schedule your own downtime, turn off the news, reserve time for relaxing activities, and maintain open lines of communication with your family.
That sounds like great tips. As we wrap this up, I just wanted to ask, I know that obviously you've been following this closely for not only your career purposes, but also your family's purposes as well. And as you look at this and kind of assess where we are and where we could be, what are some of the things that trouble you at this point?
So one thing that's deeply troubling is the idea that it's July and we don't have the virus under control, not by a long shot in the US. And I worry that this will extend the time that kids are away from school, and thereby extending the time that they're isolated from their friends and that social support. They're isolated from that in-person instruction. So the American Academy of Pediatrics just recommended that in-person instruction should begin in the fall. But it's worrying to me, and I'm sure a lot of other professionals, the idea that can this be done safely? Can we really truly bring the kids back to school in a way that's safe for them and their teachers right now? And given that this is uncharted waters, as you said, we need to understand how this missed school and this time has impacted our kids. So research on the neurocognitive and psychosocial functioning of children during this time is going to be really important going forward, so that we can understand how this has impacted everyone and also create intervention programs for children and families going forward to truly address the potential outcomes of this.
So would it be safe to say people like you will be looking into this time span, not only now but in the future? This will be almost a petri dish to be studied for a long time to see what the effects are. I guess what I'm asking is, we don't really know what the effects will be until we get through all this. Well,
you're so right. We won't know what the effects will be, and this is an area that will be continued to be studied for our lifetime and for generations to come, because it is likely that the impact of this time will be seen in our generation, but in the future generations, both in their academic and educational achievement, but also in just the way our world works.
Janelle, thanks for sharing your thoughts and your expertise. We appreciate you coming by today.
Thank you for having me, Ken.